Hello there, folks. Daniel Bragg here. I'd like to welcome you to the audio and video narration of my book, Medicare Secrets. I hope you enjoy. Medicare Secrets, the ultimate guide to understanding Medicare without the confusion and frustration, by Daniel Bragg. Audiobook, narrated by Daniel Bragg. Preface: Understanding Medicare. 3 key decisions you'll need to make. Choice number 1, you must decide how you will receive and pay for your Medicare benefits. You have 3 options that I will soon outline so you can make a decision that meets your needs. Choice number 2, you must choose between buying directly from the insurance company or using an insurance broker representing multiple insurance companies. The broker should guide you to the plan that meets your needs without bias. The critical thing to remember is when you buy from the insurance company, they represent their interests. And when you use an insurance broker, they represent your interests. The price is the same whether you go directly to the insurance company or you use a broker. Choice number 3. If you're considering using an insurance broker like myself to help navigate and make informed decisions about your Medicare options, you might be wondering who can provide you with the best value. This book aims to provide an objective and unbiased analysis of all the Medicare options available to you, and I hope it proves to be useful. Now that you have a better understanding of your choices, allow me to introduce myself. My name is Daniel Bragg, and I'm an insurance broker, a licensed fiduciary financial advisor, and the founder of Bragg Capital Management, a registered investment advisory firm. As a fiduciary, I'm obligated to act in your best interest, which means I'll always put your needs first. It's important to note that this isn't always the case with insurance brokers, insurance companies, or call centers. If you decide to work with me as your Medicare broker, I hope you'll take advantage of the valuable programs and online communities I've created to help you improve your health and well-being. Number 1, full concierge support. Medicare Advantage plans are known to deny treatment and not pay claims. If you find yourself in this position, we are here to help. Number 2, provider search. We will help you find highly recommended doctors, dentists, and specialists in your area. 3, annual reviews. We will ensure that you get the best rates and benefits every year. Number 4, Medicare Max. We have created a private community for our clients where we teach you how to get the most out of your Medicare benefits. 5, cash flow secrets. Cash flow that lasts through your retirement is critical. So I've created a private online community where I teach you investment strategies that I've used with my investment advisory clients. For suggestions or feedback to improve my services, please email me at reachme@danielbragg.com. Medicare Explained. The saying, keep it simple and straightforward, or KISS, emphasizes that we need to understand a product to use it effectively. Otherwise, we may feel frustrated and confused, leading to an unpleasant experience. Unfortunately, Medicare is currently a complex system with various parts and plans that were not designed using the KISS method. Nevertheless, this book will guide you to the right system that suits your needs from the start, making Medicare the best health insurance you've ever had. Look for the Don't Make This Mistake sections throughout the book, where 11 common Medicare enrollment mistakes are highlighted. The parts of Medicare: A, B, C, and D. It's important to understand that each part of Medicare has its own coverage and associated deductibles, copays, and coinsurance. Therefore, it's crucial to know what each part covers. After that, we can discuss the costs and your options for paying those costs. Part A. Hospital insurance covers hospital services when a doctor admits you, including inpatient surgery. Examples include daily room and board, laboratory services, diagnostic tests, surgical equipment and supplies, anesthesia, other items or services that are necessary for your care as a hospital inpatient. Part B. Medical insurance covers outpatient care services, home health care, and durable medical equipment. Think doctors, anesthesiologists, physical therapists, and anything needed to treat you. Part C. Medicare Advantage, also known as Medicare Part C, involves a private insurance company to manage your Medicare benefits. This includes Part A and Part B coverage. Instead of using your red, white, and blue Medicare card, you will present your United Healthcare ID card to your doctor or healthcare provider. If you have a Medicare Advantage prescription drug plan, your drug coverage is combined with Parts A and B and D into one plan. Part D. Part D is a standalone drug plan that should be purchased with Parts A and B. Failure to enroll in a Part D plan results in a late enrollment penalty. Medicare secret number 1. 3 coverage choices you need to know. The following information explains the 3 options available for receiving Medicare benefits, including their advantages, drawbacks, and risks. Choice number 1 is original Medicare Parts A and B plus a Part D plan. The benefits are: 1. You can access any Medicare-approved doctor or medical facility in the country, almost all doctors except Medicare. 2. Medicare covers medically necessary expenses, and healthcare decisions are made between you and your doctor. Risks. 1. You are taking a significant risk because you are responsible for the deductibles, copays, and coinsurance that can result in unlimited financial risk. Drawbacks. Number 1, you need to purchase a standalone Part D prescription plan and a plan for dental, vision, and hearing benefits. 2, you must always pay the $174.70 per month for your Part B coverage if your income is below $103,000 per year as of 2024. Choice number 2, original Medicare Parts A and Parts B plus a Medicare supplement and a Part D plan. Benefits. 1, you can access any Medicare-approved doctor or medical facility in the country, almost all doctors except Medicare. 2, the insurance company that offers the supplement plan is a silent partner and cannot interfere with your medical care. You and your doctor will make all the healthcare decisions together. Medicare will cover its share of all medically necessary expenses, while the supplement plan will take care of the Part A deductible, copays, and coinsurance. However, you will have to pay the Part B deductible, which is $240 in 2024. 3, supplement plans limit your annual out-of-pocket expenses. More on that later. Risks include: 1, increasing premiums year over year. 2, if you happen to miss your initial enrollment period, which is the 6 months right after your 65th birthday, or when you start Part B, you will be required to answer medical history questions. It's important to note that if you fail these medical questions, the supplement company can deny you coverage. Drawbacks. 1, the monthly premium for the Medicare Supplement Plan G, the most popular plan in California for a 65-year-old male when this book was written, was $156 per month. 2, you'll need to purchase a standalone Part D prescription plan and a plan for dental, vision, and hearing benefits. 3, as of 2024, you must always pay the $174.70 per month for your Part B coverage if your income is below $103,000 per year. Choice number 3, Medicare Advantage with a prescription drug plan. Benefits. 1, most Medicare Advantage plans have $0 monthly premiums, but the average premium is $18 per month across all Medicare Advantage plans. 2, the plan has a maximum out-of-pocket that protects you from unlimited financial liability. 3, it is possible that additional benefits such as access to a gym membership, dental, vision, over-the-counter, and hearing benefits may be provided. 4, most of the plans have Part D prescription drug coverage included. 5, if you rarely visit the doctor and are in good health, certain counties offer Part B give-back plans that can assist you with your Part B premiums. Risks. 1, the insurance company has the power to reject procedures and limit treatments recommended by your doctor. 2, you are restricted to using in-network doctors and hospitals. 3, HMOs require referrals from primary care providers and prior authorizations for procedures, leading to healthcare delays. 4, Advantage plans may result in high out-of-pocket costs due to the large 20% coinsurance gaps in coverage related to cancer treatment and Part B drugs, which may cause you to reach the maximum out-of-pocket for the plan. 5, you can only receive urgent or emergency medical treatment outside of your coverage area. All other medical care must be received within your coverage area. Drawbacks. 1, your doctor may leave the plan mid-year, which means you would need to find another doctor. 2, plan benefits can change yearly, so you'll need to watch for this or have an insurance broker who does. 3, the benefits of a plan can differ greatly from one county to another. I'll provide more information about this later. 4, you must always pay your $174.70 per month for your Part B coverage if your income is below $103,000 per year as of 2024. As you can see, each Medicare coverage option has its own set of benefits, costs, and risks. To help you decide which one is the most suitable for you, I'll walk you through each part of Medicare and explain how they work. This should give you a better understanding of all your options. Don't make this mistake number 1. Understanding the difference between a Medicare supplement plan and a Medicare Advantage plan is important. Making a mistake in choosing the wrong plan can have irreversible consequences. Part A, costs and gaps. How much does it cost? You don't have to pay anything if you've worked in the U.S. for at least 10 years. Your spouse's work history can also apply if you are a stay-at-home parent. Part A, financial gaps. 1. Part A includes a hospital admission deductible of $1,632 per year. This deductible is based on benefit periods that can be paid multiple times per year. Let's say you're admitted to the hospital and are released. You have a 60-day window where you can be readmitted without paying the deductible again. However, if you are admitted after this 60-day window, you will start a new benefit period and you'll be responsible for the $1,632 deductible again. 2. Part A has hospital copays that increase over time, starting at $408 a day for days 61 through 90 and going up to $816 a day for days 91-3. Part A has a daily $204 copay for skilled nursing care from days 21 to day 100. How to close the Part A gaps. Number 1, Original Medicare Parts A and B. Original Medicare does not cover all expenses, leaving you responsible for unlimited financial liability for all Part A gaps listed above. 2, Original Medicare plus a Medicare supplement. Medicare supplements plans F, G, and N cover all of the Part A deductibles and copays. You can stay in a hospital for a year without receiving a bill. 3, Medicare Advantage. To illustrate how different plan benefits can be, I will compare 2 $0 premium Medicare Advantage plans from 2 neighboring counties. Good. This plan covers unlimited inpatient hospital days with a $0 copay, and you do not have to pay the $1,632 deductible. Skilled nursing copays are $50 a day for days 21 through 100. The plan includes a maximum out-of-pocket of $600 per year. The bad. For the 6 days of your hospital stay, you will have to pay a $300 per day copay, resulting in a total of $1,800 if you're hospitalized for 6 days. Skilled nursing copays are $150 per day for days 21 through 100, and this plan includes a maximum out-of-pocket limit of $4,900 per year. My thoughts on Part A coverage. When managing your healthcare coverage, expenses, and financial risks, it's important to understand the differences between Original Medicare and Medicare Advantage plans. While Original Medicare and supplement plans are fairly straightforward, the coverage and costs associated with Advantage plans can vary depending on your location and plan details. If you choose an Advantage plan with a low $600 maximum out-of-pocket, you'll know exactly how much you'll be responsible for each year. However, if you move to a different county, your maximum out-of-pocket could increase significantly to $4,900 per year. That's why it's important to fully understand all of your coverage options before making a decision. Part B, costs and gaps. Part B is less complex, but it carries a higher financial risk. How much does it cost? In 2024, the Part B premium for Medicare is set at $174.70 per month. However, your premium might be higher if your adjusted gross income as a single person exceeds $103,000 per year or $206,000 per year if you're married. It is important to note that you are always responsible for paying this premium, no matter what type of Medicare coverage you choose. Financial gaps in Part B. 1. The one-time calendar year deductible is $240. 2. You have a coinsurance of 20% with no cap or out-of-pocket maximum. 3. Physicians can charge up to 15% more than the Medicare-approved amount, but only a small percentage of doctors actually do. Aetna reported that only 4% of all doctors charge this fee. How to cover your Part B gaps. I will use a knee replacement costing $50,000 as an example to show how your coverage options would work. Option number 1, Original Medicare Parts A and B. You're responsible for paying the Part B deductible and a 20% coinsurance on the knee replacement. The deductible costs $240, and the coinsurance on the remaining bill is $9,952. Option number 2, which is Original Medicare plus a Medicare supplement. Medicare Supplement Plan G is currently the most popular option available. In California, the monthly premium for this plan is $156 per month, which amounts to $1,872 per year. If you opt for this plan, you would be responsible for paying the $240 deductible for the knee replacement, while Plan G would cover the 20% coinsurance. Option number 3, Medicare Advantage. I will simplify the $50,000 knee replacement example by using a $0 premium Medicare Advantage plan and focusing on copays for MRIs, doctors, and specialist visits. A good plan, you have primary office visits at a $0 copay, specialist office visits, $0 copay, outpatient surgery, $0 copay, physical therapy, $0 copay, MRIs or x-rays, $0 copay. If you needed a knee brace, you would pay a 20% coinsurance. The bad, primary care office visits are a $0 copay, specialist office visits are a $0 copay, outpatient surgery copay would be $100, physical therapy copays would be $10, MRIs and x-rays would be a $0 copay, and a knee brace would carry a 20% coinsurance. The quality of the Part B coverage with a Medicare Advantage plan is good, but it depends on location. Part B Medicare Advantage cancer gaps. 2 examples of Medicare Advantage plans mentioned above have a significant financial gap in terms of the 20% coinsurance for Part B, which includes chemotherapy drugs and radiation therapy. This coinsurance can be quite expensive and is often overlooked. These treatments can quickly add up and lead to you reaching your maximum out-of-pocket limit for your Medicare Advantage plan. Don't make this mistake number 2. When selecting a Medicare Advantage plan, consider available policies to offset out-of-pocket costs for cancer, heart attack, and stroke. Part D refers to your prescription drug coverage, and it's often the most complicated to understand. You need to enroll in Part B either during your initial enrollment period or after you lose credible drug coverage from your employer. If you lose employer coverage, you will have 63 days to enroll in a plan. If you do not enroll in a plan within this time, you will have to pay a late enrollment penalty. It's important to note that there are 4 levels within a Part D plan, each with its own copays or coinsurance for the same drugs. So make sure to carefully choose the plan that best fits your needs to avoid unnecessary expenses. Instead of explaining the complexity, I'll show you the best way to estimate your yearly drug-related costs, which will save you some time. Medicare secret number 2. Want to know the best way to estimate your prescription drug costs? Here's how. If you have a Medicare supplement, here's what you'll need to do step by step. Number 1, head to www.medicare.gov and click Find Plans. 2, create an account to store your drug information. Easily update your information and shop for your Part D plans annually. 3, select the type of plan you want. Select Medicare Drug Plan Part D. 4, next it will ask, do you get help with your costs from one of these programs? Click I don't get help from any of these programs. 5, then enter all of your drugs. You'll need the exact name, dosage, quantity, and frequency. When finished, click Done Adding Drugs. 6, next you'll enter your zip code and select up to 5 pharmacies. Click Done. 7, on the next page, you'll see a list of all the drug plans available in your area. To sort them by estimated annual drug costs, click the drop-down menu on the right and select Lowest Premium plus Drug Cost. This will help you compare and choose the most cost-effective plan for you. 8, please note that you should use the preferred pharmacy for the plan selected because that is where you'll have the lowest out-of-pocket costs. 9, the final step is to click Enroll and go through that process. 10, breathe easy, knowing that you've found the right Part D plan at the right price to meet your specific needs. Don't make this mistake number 3. It's important to review your prescription drug plan or Medicare Advantage plan every year, as insurance companies may remove certain drugs from the formulary or change the tiers in which your prescriptions are placed. These changes can increase your costs. To avoid surprises, I recommend following the steps mentioned above or seeking guidance from a trusted insurance broker. Don't make this mistake number 4. The Extra Help Program is a low-income subsidy provided by Medicare to help people with limited resources cover the cost of prescription drugs. Your income and assets will be considered to be eligible for the subsidy. If you qualify, this program can reduce your Part D premiums, waive your deductibles, and lower your copays. It is important to apply for this program if you meet the requirements, as it can significantly reduce your out-of-pocket expenses for prescription drugs. Please reach out to me if you need any help applying for this program. Medicare secret number 3. Access to the health care you need is determined by your network. Original Medicare plus a Medicare supplement. You have the freedom to go anywhere and access the coverage without the need for a referral. You enjoy unlimited flexibility and peace of mind, knowing that your healthcare needs are covered across all networks. Medicare Advantage equals PPO and HMO networks. This entails managed care, limited provider networks, prior authorizations, and reduced treatment options. PPO, or Preferred Provider Organization networks, are the most commonly selected networks for Medicare Advantage plans. These networks are more extensive and flexible since you are not required to choose a primary care physician. This means that you can see a specialist without needing a referral. Because of their flexibility, PPO plans often have increased cost sharing. However, you may have higher copays, out-of-pocket limits, and reduced dental, vision, over-the-counter, and hearing benefits. While you can still see doctors who are out of network, you must ensure that the doctor-provider accepts Medicare assignment. It's worth noting that not all doctors will accept Medicare assignment. HMOs, or health management organizations, are healthcare plans managed through a primary care physician or gatekeeper. This means that the primary care physician is responsible for directing your care and making referrals to specialists as needed. While these plans typically have lower out-of-pocket costs and offer enhanced dental, vision, over-the-counter, and hearing benefits, there is a trade-off. Accessing the care you may need may require patience as you navigate the referral process. My experience with a PPO versus an HMO. In the past few years, I've had 2 knee surgeries. The first, I had a PPO. The second, I had an HMO. Example, knee surgery number 1 with a PPO. 5 years ago, I suffered an MCL tear. Due to my PPO plan, I was able to schedule an MRI to immediately diagnose the problem. After learning that I had a complete MCL tear and a possible ACL tear, I consulted several orthopedic specialists to get a proper diagnosis. Interestingly, the first 2 opinions suggested an ACL reconstruction surgery, which I had undergone 20 years ago. I knew it was a complex procedure with a long recovery time, so I decided to get a third opinion and asked for references. This led me to Dr. Richard Ryu, an orthopedic surgeon in Santa Barbara who had treated some famous pro athletes. Luckily, he accepted my PPO and I scheduled an appointment. I was surprised when he told me that I only had a torn MCL that would take about 2 months to heal. He also advised me that anyone who suggests an ACL reconstruction or any surgery is not being honest with me. I was amazed that I no longer needed surgery. With just a 1-hour drive, I avoided a long and painful recovery. 5 years later, my knee is as good as ever. This is an example of how a PPO works, giving you the flexibility to treat health issues and determine the best treatment. Example, knee surgery number 2. This past year, I've been struggling with knee pain that had prevented me from participating in my favorite sports and activities. My wife, Andrea, is a registered nurse for Kaiser Permanente, one of the largest HMOs in the country, and also happens to be our health insurance provider. Although I'm satisfied with the treatment I received through Kaiser, my experience highlights the differences between PPO and HMO plans. Initially, when I visited my primary care physician, who tried to diagnose my knee pain with an x-ray, but nothing unusual showed up. To get a referral to an orthopedic specialist, I had to undergo 3 months of physical therapy. After that, I was able to schedule an appointment with an orthopedic doctor who ordered an MRI to diagnose any knee-related issues. Once the MRI results were available, it was revealed that I had a torn meniscus, and the doctor recommended surgery, which was performed successfully. This process illustrates how HMOs work, where a primary care physician or gatekeeper slows down the treatment. Since I am within an HMO organization, getting a second opinion from Dr. Ryu would require me to pay out of pocket. Moreover, regardless of Dr. Ryu's opinion, I would still have to use a Kaiser surgeon for the procedure. Delayed treatment is one of the most significant complaints of Medicare Advantage HMO plans, and it could be a matter of life or death depending on your health issues. I hope these examples have helped you understand the differences between original Medicare and a Medicare Advantage PPO or HMO. Medicare secret number 4, enrollment periods. Don't miss out on important deadlines. Initial enrollment period, or IEP, starting with your first and most important enrollment period. If you're not currently receiving Social Security benefits and are not covered under a large group, which is 20 or more employees, You must take action to enroll. Setting up your Medicare the right way is crucial to avoid paying penalties or needing to make corrections in the future. Your initial enrollment period is the 7-month period surrounding your 65th birthday or when you first become eligible for Medicare. This period starts 3 months before your first month of eligibility, includes the first month of eligibility, and ends 3 months after that. You can enroll in Medigap, Medicare Advantage, and Part D prescription drug plans during this period. Please refer to the table below to know the exact start and end dates of your initial enrollment period. Don't make this mistake number 5. If you sign up for Medicare during the month of your birthday, your coverage will not begin until the following month. For example, if your birthday is on June 7th and you enroll in Medicare during June, your coverage will not start until July 1st. This means that there will be a gap in your coverage during this period. If you're currently on an employee group plan or an ACA plan, these plans will become secondary payers once you turn 65 and are eligible for Medicare. Waiting until the last 3 months of your initial enrollment period can be risky, as you may be responsible for any hospital or medical bills incurred during the 3-month gap before your coverage begins. To avoid this mistake, it's recommended that you schedule an appointment 60 to 90 days before your birth month. This will ensure that your coverage starts on time and that you do not go without health insurance. Don't make this mistake number 6. Please sign up within your enrollment period to avoid a penalty. This penalty is 10% per year for your Part B premium and 12% per year on your Part D. This will be added to your premium for each year you were not enrolled after becoming eligible. Medicare Supplement Open Enrollment. This is the 6th-month period after turning 65, during which you can purchase a Medicare supplement policy without undergoing medical underwriting or answering any health-related questions. Annual Enrollment Period. Between October 15th and December 7th, you will receive a lot of mail and phone calls and see TV commercials featuring football legends like Joe Namath talking about the benefits you may be entitled to. This is the enrollment period for Medicare Advantage plans, which are the focus at this time. Because these plans have annual contracts, insurance companies can change the benefits of your Advantage plan every year. This means that copays, coinsurance, deductibles, max out-of-pockets, dental, vision, hearing, and prescription drug benefits can change yearly. Before the enrollment period starts, you will receive an annual notice of change document from the insurance company. You should review the changes in benefits and confirm that your doctors still participate in the plan. If you decide to switch plans during this period, your new plan will be effective from January 1. Don't make this mistake number 7. When signing up for your Medicare Advantage plan, it's best to avoid enrolling directly with the insurance carrier. They typically won't provide information about other insurance companies' plans. Instead, I suggest working with a licensed insurance broker who represents multiple insurance companies. This way you can review and compare plans each year. Additionally, we can help you navigate the appeal process if you encounter any issues with treatment denials. It's important to note that there is no difference in price or benefits whether you purchase directly or through an insurance broker. Don't make this mistake number 8. Please keep the following information in mind. Do not call the phone numbers that you see on TV advertisements. Doing so may result in your contact information being sold to insurance agents, and you may receive frequent phone calls from them for months. Similarly, do not fill out lead forms online with your personal information. This could also lead to the same outcome. Instead, I suggest you work with a broker who allows you to discuss your Medicare needs on your own terms. You can visit our website, www.danielbragg.com, where we have a convenient schedule available for you to book an appointment. Alternatively, you can call us directly at 866-788-4099. Open enrollment period. The open enrollment period runs from January 1 to March 31st, during which you can change to a different Medicare Advantage plan or switch from an Advantage plan back to original Medicare. This period provides a second chance for those who missed the annual enrollment period to change their plan. Additionally, it offers the flexibility to review the plan you might have switched to during the annual enrollment period and correct any possible mistakes. Don't make this mistake number 9. If you're considering dropping your Medicare Advantage plan and switching back to original Medicare and enrolling in a Medicare supplement plan, however, before dropping your Advantage plan, make sure to confirm that you can medically qualify through underwriting. Keep in mind that you will not be able to return to the Advantage plan until the next annual enrollment period. If you drop your Advantage plan without first confirming eligibility for a Medicare supplement plan and are then declined by the insurance company, you could face significant medical expenses. Special enrollment periods. A special enrollment period allows you to enroll in Medicare-related plans outside of general enrollment periods. You may qualify for a SEP based on specific needs. Examples include loss of employer coverage, FEMA disasters or other emergencies, change of Medicaid or low-income subsidy status, when you move outside of your coverage area, SEP for individuals that have enrolled in Medicare Advantage plans, offering a 12-month trial period, which will provide you the ability to switch back to a supplement plan without undergoing medical underwriting. This opportunity can only be used once and must be used within that 12-month window. Don't make this mistake. Number 10, the general enrollment period. If you fail to enroll in Medicare Part B during your initial enrollment period, you can enroll during the general enrollment period. The general enrollment period is held every year from January 1 to March 31st. It provides an opportunity for those who missed their initial enrollment period and do not qualify for the Part B special enrollment period to enroll in Part B. If you enroll during the general enrollment period, your coverage will begin the first day of the month following your enrollment. However, you will also likely have to pay a Part B late enrollment penalty. Medicare supplement plan choices. Now that you know when you can enroll, let's talk about the 3 most popular Medicare supplement plans available. As described before, Medicare supplement plans help you fill the 6 gaps that original Medicare leaves as your financial responsibility. Remember, all Medicare supplement plans offer the same coverage, regardless of which insurance company you choose. The only difference between plans is the monthly premium you'll pay. The 6 gaps. 1. Part A deductible of $1,632 per year. 2. Part A hospital copays, $408 a day to $816 per day. 3. Part A skilled nursing copays, which are $204 per day. 4. Part B deductible, which is $240 per year. 5. It's your Part B coinsurance at 20% of the bill. 6. Excess charges, which can be up to 15% of the bill. Plan F fills 6 of the 6 gaps. Premium for this plan on a 69-year-old male in California is about $200 per month. Plan F is no longer available to anyone eligible for Medicare after January 1, 2020. This plan is very straightforward to explain because it fills all the gaps that original Medicare leaves. Plan G fills 5 of 6 gaps. Premium for a 69-year-old male in California is about $172 per month. Plan G is very similar to Plan F, but it does not cover the Part B yearly $240 deductible. If you are not eligible for Plan F, then Plan G is the Medicare supplement with the best coverage. However, it is important to note that the premium for Plan G is $336 less than Plan F. So in this case, Plan G is a better value than Plan F. It's always recommended to compare the total costs of each plan before making a decision. Plan N covers 4 of the 6 gaps. Premium for a 69-year-old male here in California is about $150 a month. Plan N is a cost-saving Medicare plan that provides comprehensive coverage except for the Part B deductible and the 15% excess charges. Excess charges are rare, and some states prohibit them altogether. Unlike other Medicare plans, Plan N also has a copay of $20 per visit for primary care and specialist visits with a cap. If you visit the emergency room and you're not admitted to the hospital, you will have to pay a $50 copay. This plan is perfect for people who visit the doctor infrequently and want to save on their healthcare costs. Don't make this mistake. Number 11. It's not recommended to purchase a Medicare supplement directly from insurance companies as they only offer their own products and won't provide yearly reviews or compare rates with other plans in the area. About the author. Daniel Bragg is the founder of a fiduciary investment advisory firm and an insurance broker. He also works as a financial coach, helping people manage their investment insurance decisions. Daniel became interested in Medicare after encountering numerous horror stories about how Medicare beneficiaries were treated during their journey. He found the abuse and harassment by call centers, advertisers, and agents unacceptable. Shockingly, 99.5% of these agents are not fiduciary advisors and are not obligated to act in the best interest of their clients. Daniel finds this to be completely unacceptable. Daniel believes Medicare should be easy to navigate with the help of a trusted advisor who serves your best interests at heart. That's why he created an environment that provides unbiased advice without pressure. Ultimately, he aims to become a valuable resource for his clients and students in his community. Thank you for listening to this book. If you need help with any of your Medicare needs, please feel free to call us at 866-788-4099, or if you'd like to schedule an appointment, go to www.danielbragg.com. Schedule an appointment today.